Hi everyone, welcome to Med Shorts, which explains you the important topics of your med school within very little time to make your work easier. And I selected today's topic from the subject microbiology, which is very much integrated with pharmacology. And I selected this question to understand the topic, and the question is in the form of clinical vignette, which reads, a 24-year-old female came to the clinic complaining fever, chills, malaise. She traveled to Africa for vacation and returned to home 20 days ago, during which she used weekly mefloquine as prophylaxis and stopped using on the day of return. On examination, her temperature is 101, blood pressure is 110/60, pulse rate is 96, and her labs show mild anemia and peripheral smear shows intraerythrocytic Plasmodium falciparum. Assuming her home place is not endemic to PF, which of the following is the most likely underlying cause of her infection? The options are release of dormant hypnozoites from liver, chloroquine resistant forms, escape of liver schizons, and inactivity of mefloquine against gametocytes. Pause the video and think the answer and keep it in your mind.
Okay, are you done with the answer? So let's get back to the question and understand what it is actually asking. There is a patient from non-endemic area went to endemic area for vacation. And as a precaution, she took mefloquine as chemoprophylaxis. As she came back to her home 20 days back, she stopped the prophylaxis. Now, she is positive for Plasmodium falciparum. So, in spite of taking prophylaxis during her entire stay, why did this happen? I think to understand this clearly, we should have a thorough knowledge of life cycle of Plasmodium in human. Let's understand it with the help of this picture. So, the cycle starts with the bite of female Anopheles mosquito. It injects sporozoites, which are the infective stage to human beings, into our system. And these sporozoites, they infect hepatocytes in particular. And inside this hepatocyte, they eat, grow and become a sac. And this sac is known as schizont. Schizont is nothing but a huge sac containing n number of merozoites. And when the time comes, this schizont bursts and release the merozoites into our blood. Merozoites are the infective stage of RBC. So here comes the blood stage. We are done with the hepatic stage and here comes the blood stage. Merozoites are the infective stage of erythrocytes. And inside the erythrocytes, they become trophozoite and again they eat and become schizont. This is called RBC schizont, right? And when the time comes, again this schizont bursts and release many merozoites into the blood. These merozoites again can infect a new RBC and the cycle continues. But remember, merozoites can only infect RBCs, right? Merozoites cannot infect erythrocyte. This is very much important because just imagine, if a merozoite can infect liver in its next cycle, what happens? It is a disaster. Just sit and imagine what happens, then you will understand. So this is the life cycle of Plasmodium, which is very simple. And remember that it has two stages, that is liver schizont and RBC schizont. It is known as pre-erythrocytic stage. Pre-erythrocytic stage, and this is known as erythrocytic stage. So when a female Anopheles mosquito bites you, let's say that it injected 10 sporozoites into your blood, and these 10 sporozoites enter the liver and infect 10 other hepatocytes, right? And these 10 sporozoites to become a schizont, it takes around 4 to 40 days for a sporozoite to enter the liver and to become a schizont so that it can burst the merozoites into the blood, right? So around they burst almost at the same time, like with a gap of around 2 to 3 days. Okay, so what happens? You gave mefloquine as a chemoprophylaxis. These mefloquine, remember, it can only affect the blood stage. It doesn't show any effect on the liver stage of Plasmodium. So it kills the erythrocytic schizont, but it cannot kill the hepatic schizont. So what happened in this woman? Let's say that she reached her home on 5th of this month, right? And she had a mosquito bite on 1st of this month in Africa. She caught the flight on 5th. And now she is showing symptoms on 25th, that is 20 days after she arrived her home. On 25th she is showing symptoms. So what happened from 1st to 25th? She got sporozoites into her blood on 1st and they entered the liver, and in this 25 days they took time to become the schizont. So on the 25th day, they burst the merozoites into the blood. That's why she showed symptoms after 20 days. So what is the solution for this? Remember, any chemoprophylaxis, mefloquine in particular, you have to take it after you coming home for 4 weeks minimum. That is for 28 days, because it's the average time that takes schizont to become the merozoites. Right? This is so much important that you have to continue to take chemoprophylaxis, that is mefloquine, even after you come to your home for minimum 4 weeks. Right? So let's come back to the options and eliminate the wrong ones. So option A, release of dormant hypnozoites from liver. Hypnozoites, first of all, they are not the stage of Plasmodium falciparum. Hypnozoites you see in vivax life cycle, which I am going to discuss in the next video. Chloroquine resistant forms. Chloroquine, we generally use this for treatment. Nowadays we are not using that chloroquine that much because many of the strains are resistant to chloroquine. And escape of liver schizonts. Yes, this is the answer. Mefloquine can only kill the erythrocytic schizonts, but it doesn't kill the hepatic schizonts. That is why you have to continue to take your chemoprophylaxis even coming your home place for 4 weeks. Inactivity of mefloquine against gametocytes. No. This also I am going to say. See, there is another stage in Plasmodium, that is gametocyte. Some of the trophozoites, after entering the RBC, they become gametocyte stage apart from schizonts stage. This gametocyte stage, it is not that much pathological to our humans. This gametocyte stage is the infective form to the mosquito, right? Imagine there is a patient affected with malaria, that is having Plasmodium falciparum in his blood. And there comes this innocent mosquito which didn't have any Plasmodium infection in it. It sucked the blood from this man. These gametocytes enter the mosquito and they become the zygote, and now that mosquito is positive for the sporozoites. Now this mosquito can infect the other human. So to stop the community spread, that is the transmission of malaria, we have to give the drugs against gametocyte. Again, I am going to explain the entire treatment and chemoprophylaxis in the life stages of vivax and chemoprophylaxis and treatment of falciparum in my next video. So this is not the answer because gametocytes do not do anything about the pathogenesis of malaria. So I think C is the answer. I think you understood the topic in whole, and stay tuned to my channel. In my next video, I'm going to give an very good explanation for the treatment chemoprophylaxis of falciparum and vivax. Thank you. If you like the video, please consider liking it and share with your friends, and please do comment about the changes that I have to make and the other topics you need from me. Thank you.